India is one step closer to receiving foreign vaccines now, and importantly, the apex drug regulator has decided to waive off some of the bridging trials that will be for the requirement of foreign vaccine that will be conducted post-launch. Now, the relaxation will be kicking in if the vaccines have a similar nod from specific countries already or a prominent global health body. However, the requirement to conduct safety study on first 100 recipients will be for 7 days. That will still be in place in India when these foreign vaccines arrive. US-made Moderna and Pfizer mRNA vaccines are already set to roll out in the country. Sources have told India Today that the Modi government is likely to grant an indemnity clause to the two vaccines along the lines of what has been granted in other countries. Now, what is vaccine indemnity clause? That refers to legal protection to a manufacturer or even a distributor from any claim that arises due to a possible adverse effect after you get a jab. Both Moderna and Pfizer have that indemnity clause in all the countries, including the United States of America, where they have rolled out these vaccines. So I'm going to go across on that detail to our correspondent Milan Sharma. Milan, what is very interesting in this is that while there will be no post-bridging trials and the vaccines may come in soon, does that raise any concern at all for the people here in India who will be receiving those jabs?
Well, certainly, Pooja, there are concerns because, number one, we are looking to expedite the entry of Moderna and Pfizer vaccines in the country. Second, we're also moving forward, most likely to provide them an indemnity coverage also has been done by other countries like the US and the UK. But the difference there is that credible drug regulators such as the US FDA or WHO and the MRHA, the one in the UK or one in the European Union, has provided them the emergency use authorization looking at the data of these vaccines. Now, once these vaccines come to India, it's very important in India. We do batch testing also in the Central Drugs Laboratory in Himachal Pradesh, Kasauli, and they are tested for sterility and toxicity and safety. Studies are done on these vaccines. Now, both the move forward and give them indemnity is one thing, but the second thing that the government is also doing to expedite these vaccinations in India at this point is that they will also not be needed to do a bridging study now. They'll just come forward and a review of these vaccines will be done by the Kasauli lab. So there are concerns that the experts will raise, health experts will raise, of processes being bypassed to bring these vaccines sooner to the country. But that is the need of the hour, apparently, and that is why the government is taking such decisions right now.
So let's hope that the government gives an assurance to people before these vaccines start to be given to the public as well. Thank you so much. Milan Sharma has been tracking all the latest. Now remember, 30